did you follow up what happened to the patient? Or how did they manage the patient?
Ma'am, record has not been taken, but it has been informed to clinicians.
Okay.
And the patient was recovered from this infection, and patient has discharged.
Good. And from the trend of isolation, from where all you have got your MRSA, can you pass a comment on how many could have been CA MRSA and how many could have been HA MRSA?
This study should be carried out, ma'am, but I haven't found. I will be present in the next phase, ma'am.
Okay. Okay.
Thank you so much,
Thank you.
Any questions from audience?
You said that vancomycin and linezolid may be the last kind of drugs, but any other newer anti-MRSA drug recently being introduced, you know, any of this?
The MRA recently used, I know only about vancomycin and linezolid, ma'am.
There is any drug.
Okay. So which one? Okay.
Thank you.
Thank you so much.
A certificate from Dr. Gandham madam. Kader Vishek, please collect a certificate from Dr. Gandham madam.
Hello. The next OB-19, bacteriological profile of bloodstream infection among adults in tertiary care hospital, Dr. Prerna Robinson, GMC Nagpur.
Good morning, everyone. I'm going to present on the topic bloodstream infection among adults in a tertiary care hospital in central India. As we know, bloodstream infection are an important cause of mortality and morbidity and among the most common healthcare associated infections. And it is self-limiting infection to it causes the life-threatening sepsis that requires rapid and aggressive antimicrobial treatments, as it caused mainly by the multi-drug resistant organism, which is more likely to prolong the hospital stay, and it increases the risk of death and require treatment with more expensive antibiotic. Therefore, our aim of the study is to isolate the various organisms which causing the septicemia and their antibiotic sensitivity pattern. This would help our clinician to initiate the empiric antibiotic therapy. Materials and methods, it is a cross-sectional study and total 366 samples were taken. Duration is of 1 year and all the samples were collected from the adult patient using the strict aseptic precaution, and it was inoculated in the BHI and processed in the microbiology laboratory. Extended spectrum beta-lactamase detection done by the phenotypic confirmated disk diffusion methods. And the isolation and the identification of organism as they were done by according to as per the standard guidelines, and it was determined by the Kerberos disk diffusion method as per CLSI guideline 2020. Result, this table shows the among the 360 blood culture samples were received, among which it shows the maximum samples were from the males, contributing the 54.37%, and the maximum isolates from the age group, it's from the 46 to 60 years age groups. This figure showing the sex-wise distribution, among which the male was the predominant, followed by the females, among the positive culture. This table shows the positive culture, among which the 366 patients investigated for the blood culture. 63 samples were found with the culture positive, among which the gram-negative organism isolates were the more, followed by the gram-positive organisms. This figure showing that among the gram-negative organism, enterobacterials, including Klebsiella pneumoniae, found to be the among the predominant, followed by the Acinetobacter species, and among the gram-positive isolates, Staphylococcus aureus shows the maximum percentage. This shows the distribution of cases based on the clinical diagnosis: genitourinary infections followed by the respiratory infection, followed by the soft skin and soft tissue infections. This table showing the antibiotic sensitive pattern of the gram-positive cocci, among which the MRSA found to be the sensitivity toward the Staphylococcus MSA to be the 9 isolates, among which the vancomycin and linezolid they are found the 100% sensitivity for. This table showing the antibiotic sensitive pattern of the enterobacterial gram-negative organism. They are highly sensitive to the carbapenem, aminoglycoside, amikacin, and the tobramycin. And this table showing the ESBL production, among which the Klebsiella I found only the 2 isolates which are ESBL producer, followed by the E. coli. This antibiotic sensitivity of the Pseudomonas, Aeruginosa, and the Acinetobacter species, among which I found the on maximum showing the amikacin, they show the sensitive pattern, for, and the piperacillin and tazobactam, they also show the sensitive pattern, followed by the carbapenem. Discussion. Bloodstream infection is a challenging problem. In our study, male has higher positivity, showing the 65.07% compared with the Kaur Singh et al., which also shows the same 65% positivity. Blood culture positive 17.21%, which is also compared with the Arora et al., showing the 20.02%. And the gram-negative isolates were more, followed by the gram-positive. According this also in accordance with the Garg et al., showing the 67%. Among gram-negative isolates, Klebsiella pneumoniae is a more predominant. This study is also similar to the Radha et al., which shows the 24.2%. The most common gram-positive organism is Staphylococcus, 20.63%, which is followed by the Enterococcus species. This also shows the similar finding with the R. Sharma et al., which shows us 25.08%. 25.8%. In our present study, all isolates of Staphylococcus aureus were resistant to penicillin. Among 13 isolates, 4 will show the methicillin-resistant Staphylococcus aureus, which also compared with the R. Sharma et al. Studies. All gram-positive isolates were sensitive to vancomycin linezolid. Similar study were also shown by the Mehta et al. In our present study, ESBL producer were the Klebsiella pneumoniae, which is predominant, followed by the E. coli, similarly reported by the Arora et al. In our present study, maximum isolates of Enterobacteriaceae were sensitive to meropenem, followed by the amikacin, tobramycin, piperacillin, and tazobactam. And the high resistance was showed by the ampicillin, first, second generation cephalosporin. This similar studies with the Arora et al. This shows the same antibiotic resistant pattern in gram-negative isolates. All isolates of Pseudomonas and Acinetobacter species were sensitive to meropenem. In our study also, we find the genitourinary infections. They are most common source of the primary source of the infection, causing the bloodstream infection. To conclude, prompt diagnosis of bloodstream infection and antibiotic sensitive pattern. This helps the clinician for the early and the proper management, and it will reduce the mortality and improve the condition, patient condition. In this era, we have to also have the counter drugs are easily available, and the drugs abuse should be controlled, and their proper formulation of the hospital antibiotic policy and strict implementation is a need of an hour. These are my references. Thank you.
Thank you. That was a neat presentation. You're specifically talking about bloodstream infections. So can you tell me 2 predisposing or conditions which will lead to or you can suspect bloodstream infections?
Ma'am, the prolonged stay of the patient, they are staying, and the use of the antibiotic, this is called the more cause of the most common, the gram-positive organism. I found that they are gram-negative isolates are the most common, followed by the gram-negative. So the antibiotics we are using, they cause the resistance, they're developing this resistance.
Okay. Did you find out that how many of them had an IV catheter or an intracath put into them?
Actually,
what was the correlation of that with your bloodstream infections?
Ma'am, IV catheters, most of the patients were the ICU patients, so they all are on the IV catheters, ma'am.
Okay, then how would you collect the blood when there is an IV catheter and you want to collect blood? What are the procedure or how do you collect the blood?
Ma'am, we have to collect the aseptic precautions and we'll have to inoculate in the BHI.
Okay. You said you got 3 fungal isolates.
Yes, ma'am.
And they were all Candida albicans.
Yes, ma'am.
Okay. Thank you. Paper is open for discussion. Okay. It's open for discussion.
just a kind of an observation. You said Klebsiella pneumoniae was resistant to ampicillin 0 and E. coli 0. So do you really need to test ampicillin for Klebsiella pneumoniae?
As they are intrinsic resistant, we don't need, but just I presented here. They show intrinsic resistant to ampicillin.
That's why the question was there. That's why the question was there. Okay. Thank you.
Thank you, sir.
I request you to kindly collect a certificate from Dr. More, sir.
वीडियो चालू है.
Next paper is OB20, Bacteriological Profile of Pyogenic Infections and their Antimicrobial Susceptibility in a Tertiary Care Hospital by Dr. Akanksha, GMC Nagpur.
Good morning, everyone. Today my topic for presentation is a bacteriological profile of pyogenic infections and their antimicrobial susceptibility in a tertiary care hospital in central India. So as we all know, pyogenic infections are characterized by local inflammation of skin, soft tissue and bodily parts, mainly by invasion and multiplication of the pathogenic organisms. And the major leading cause of these pyogenic infections are not only the leading cause of morbidity and mortality, but also for the prolonged stay of a patient in a hospital and for the further disabilities. So when there is an increase in multi-drug resistant superbugs in both community settings and hospital settings, treatment has become challenging nowadays. So it is a need of the hour that we should know the appropriate knowledge of the pathogen which is causing the pyogenic infections, which are the main organisms of that infection, and then what are their antibiotic resistant character and their updated microbial therapy also. So aim of this present study is to find the etiology of the pyogenic infections, and the objectives are to confirm the isolates by conventional methods and study the antibiotic sensitivity pattern by disk diffusion test. This study is a cross-sectional study which is conducted over a period of 6 months from October 2021 to March 2022. We have taken total 752 samples which have undergone through direct microscopy and the conventional cultural methods, and the isolates are being subjected to antibiotic susceptibility testing by KB-Bor method as per the CLSI guidelines 2021. Coming to the results, out of 752 total samples, why it is not showing?
Just check what happened. Sound? What happened?
We have seen like about 57% of the cultures have shown positive values, and the other 23% have shown no growth on the isolates. Among the 510 isolates which have been isolated from the first samples, we have seen that the gram-negative bacteria are more than the gram-positive bacteria, and among the gram-negative bacteria, we have seen that Klebsiella pneumoniae have been the predominant organism isolated, which is showing as 27%, and after that, in gram-positive bacteria, we have isolated the Staph aureus being the second most common organism, which is showing 21% among these, and the third culprit is Escherichia coli, that is 20.2%. This is the bar diagram showing antibiotic sensitivity pattern of Staphylococcus aureus. As we can see here, Staphylococcus has showing maximum susceptibility towards linezolide, that is 99.1%, followed by doxycycline, and it is least sensitive to penicillin. And we can see here that there is only 33.1% of the isolates of Staphylococcus aureus are sensitive to cefoxitin, which means we have 67% of the isolates which are methicillin resistant. This is antibiotic sensitivity pattern of Enterococcus species, which is showing maximum sensitivity to linezolide, that is 92.85%, and followed by vancomycin sensitivity, that is 81.25%. This is antibiotic sensitivity pattern of Enterobacterials, showing maximum sensitivity towards gentamicin around like 80%, and then for the piperacillin tazobactam it is like 60 to 80%. This bar diagram showing the antibiotic sensitivity pattern of non-fermenters, which is showing a maximum sensitivity towards gentamicin, that is 89.9%, and followed by this meropenem 71.8%, and piperacillin, that is 76.5%. Whereas for Acinetobacter we have seen that it is showing maximum sensitivity towards ampicillin sulbactam, that is 91.91%. Coming to the discussion, as we have seen in our study, gram-negative bacteria are more isolated, more in number than gram-positive bacteria, which is similar to Gomatheshwari et al. Study conducted in Tamil Nadu 2016. And the second thing is, among gram-negative bacteria, Klebsiella pneumoniae is the predominant organism, which has been similar to the other studies like Krishnamurthy et al. In Telangana and Gomatheshwari et al. In Tamil Nadu. And in gram-positive cocci, we have seen that Staphylococcus aureus are more in number than Enterococcus species. In study conducted by Shivankur Mukherjee et al. In HTMC, Rourkela, Odisha in 2019, we have seen that Staphylococcus aureus have shown sensitivity to 92% for the linezolide, 84% to gentamicin, 88% to clindamycin, 72% to cotrimoxazole, 25% to erythromycin, and 44% for levofloxacin, which is similar in our study. In our study, we have isolated that we have seen that 67% of MRSA have been isolated, whereas in Mohan Sundari et al. In Rasipuram 2022, it has been shown that MRSA was 50%. So we can see that the rate of MRSA is increasing nowadays. Then in our study, we have seen that Enterococcus has shown 92.85% sensitivity to linezolide, and towards vancomycin it is 81.2%, which is similar to Batra et al. Study. Coming to the gram-negative bacilli, which have shown similar findings in our study to the similarity with Shivankur Mukherjee et al. Study which is conducted in 2019, that gram-negative bacilli showed higher sensitivity towards imipenem, that is 53.93%, meropenem 80.800%, piperacillin tazobactam 67.100%, and amikacin 67 to 88%. So the conclusion is that the rate of pyogenic infections are increasing. We have seen here, we have among the total isolates, 68% are the pyogenic infections. The gram-negative bacteria are more overgoing to than gram-positive organisms. Among the gram-positive, MRSA is like increasing, that is like 67% we have found in our study, and also the vancomycin-resistant Enterococcus is also found to be 18.70%. So the conclusion is, take-home message is that continuous surveillance of the pyogenic infections has to be done, so we can get the updated knowledge of the resistance which we are finding in the pyogenic infections, and so we can arrange the proper dose regimen for the patients so that they can minimize the hospital stay in the hospitals. Thank you. These are my references. Thank you.
Thank you. That was a little hasty presentation towards the end, I guess, but never mind, that was a good one. You have made one statement in the conclusion, rate of pyogenic infections is increasing, and then you put 68%. So rate of pyogenic infections is increasing, meaning what are you exactly telling us?
Ma'am, when patient is in hospital stay or the community settings, when they are not maintaining the hygienes, or when there is indiscriminate use of the antibiotics in periphery by the regional doctors, so that due to indiscriminate use of the antibiotics, the infections are increasing. If we are not maintaining hygiene, even the clean wounds which are cleaned by soap and water, they can get infected. Because we have like nosocomial, we have like normal flora, Staphylococcus aureus there. So
okay, have you compared with the previous year to say that this 67 or 68% is more than something? I missed it. No.
in your setup, whether previous study, same study was done and you are comparing with that study.
Sir, it is increasing like from 30% to 50%.
Was it a general statement or from your institute experience? So previously study was done in your institute only, and you are comparing this study to that study, previous study. Huh? But nowhere, before, apart from this statement, nowhere comparison was found. Hmm? Okay, question, paper is, questions are welcome.
Sir, your sample size was very good. Only two things. You said ki enterococcus, you haven't speciated enterococcus, but VRE was 16%. So it is something like you need to do a speciation, whether it is Fishium, which is most common, or Ficalis. And when the gram negative were most common, and that too Klebsiella was most common, have you ever tried to speciate or identify the new variant of Klebsiella pneumoniae, which is commonly associated with multiple abscesses nowadays, and which is common strain in Asia? Are you aware of that strain? HVP, hypervirulent, mucoviscosus, right? The simple string test also can be there to identify if you are getting them in your pus samples, right?
Please collect a certificate from Dr. More, sir. To felicitate Dr. More, sir, and Dr. Gandham, madam. Thank you, judges. I request all the participants to be seated here. Shortly, we will be starting with our PG quiz.
Is going to be PG quiz. So I request all the postgraduate students to sit in the middle column in front of the stage. Prachi Dubal, welcome you all to the final day of 26th Maharashtra Chapter Conference 2022 of the Indian Association of Medical Microbiologists. I'm sure that our eminent speakers from yesterday gave you a very good insight into molecular epidemiology and genome sequencing. Now moving ahead to our today's proceeding, we have our first session, which is the most awaited postgraduate quiz. I request our enthusiastic postgraduate delegates to occupy alternate seats and make sure that you have got the answer sheets. Faculty and other delegates are requested to occupy seats on the right and left side of the stage. All the participants, please write your name, institute, and your designation on your answer sheets. I request our quiz masters, Dr. Meera Modak and Dr. Swati Mutsinkar, to come on the dais. Dr. Meera Modak is currently working as Professor and Head of Department of Microbiology at Bharati Vidyapeeth Deemed University, Medical College, Pune. She is also Lab Director of Bharati Hospital. Ma'am has been past President of IIMM Maharashtra chapter. She has huge teaching experience of 31 years and over 22 national and international publications to her credit. Dr. Swati Muchinkar is currently working as Associate Professor Microbiology at Pimpri Chinchwad Municipal Corporation Postgraduate Institute and YCM Hospital, Pune. She was awarded with Young Investigator of India Award from Bill and Melinda Gates Foundation. She has special interest in antimicrobial stewardship and infection prevention and control, and has over 22 national and international publications. I hand over the proceedings to our quiz masters.
Morning to all the PGs present here. I'm sure you all are expectantly looking forward to this quiz. Now I have to tell you all that both Dr. Swati and myself also have worked really hard for this quiz, because as soon as we were told by the organizers of BJ that we had to conduct this quiz, we delved into our textbooks also to find out from the niches of the textbook something which could be challenging as well as interesting for you all. So I hope all of you enjoy this quiz, and I think we can start. Now all of you, please put down your names, your institute, and whether you all are JR1, JR2 or JR3. Okay, so wish you all the best, and I think we will start with the quiz. Now coming to the general rules for this quiz. Now there are going to be 6 rounds. So the first is the MTFI, MCQ, mix and match, visual quiz, clinical round, and relationship analysis. Clear? So as we go ahead with the rounds, I will tell you what is expected from you all for each round. Now coming to the first, that is the multiple true and false independent questions. Now each question will have 5 options. Mark the options as true or false. Total there will be 5 questions with 5 sub-questions. Total marks are 25 for this round, and time given will be 60 seconds per question, consisting of 5 sub-questions. Clear? So should I proceed with the first question of the MTFI round? Everyone ready? Yes? So best of luck again, and may the best PG win the quiz. Okay, so the first one is related to Vibrio cholera. Now the O139 strain is endemic in all parts of India. Strains isolated from environmental sources of Vibrio parahemolyticus are usually hemolytic on high salt blood agar. There is no difference in pathogenicity among the 3 serotypes, which are Ogawa, Inaba, and Hikojima. The fourth is Group A cholera vibrios has a common O antigen. And the fifth, it belongs to the Enterobacteriaceae family. So moving on to the second question, related to Naegleria fowleri. It causes an acute and fulminating primary meningoencephalitis. Second, it does not have the flagellate form of the trophozoite. Third, the parasite invades the cribriform plate and travels along the olfactory nerves to the brain. Fourth, humans acquire infection by swimming in freshwater lakes, ponds, or swimming pools. And fifth, humans acquire infection by inhalation of aerosol or dust containing trophozoites or cysts. Coming to question 3, related to Listeria monocytogenes. It can survive at 4 degrees centigrade. It shows a characteristic tumbling motility when grown at 35 degrees centigrade. Listeria are catalase positive. The selective medium for Listeria is the Palcum agar containing polymyxine, acriflavine, lithium chloride, ceftazidime, isculin and maltose. In early onset neonatal disease, meningitis is the presenting symptom, while in late onset neonatal disease, sepsis is the common symptom. Coming to question 4, related to dermatophytosis. So infection is acquired by direct contact with soil, animals or humans infected with fungal spores. The lesions are due to tissue invasion. They are responsible for producing the Majochi granuloma. The hair perforation test is positive for Trichophyton mentagrophytes and in case of Microsporum gypsum. The color change in dermatophyte test medium is due to the production of acid metabolites. Coming to the 5th question related to hypersensitivity. In immediate hypersensitivity, passive transfer is possible with serum. Delayed hypersensitivity is T cell mediated. Type 1 hypersensitivity reaction is IgG dependent. Arthus reaction is the clinical syndrome of type 2 hypersensitivity. And delayed hypersensitivity is provoked by intracellular microbial infection. So I'll just go to the first 3 MTFIs again, since I think some students had come in late. So for their benefit, the first 3, I'll just go over them again. So the first is related to Vibrio cholera. So O139 strain is endemic in all parts of India. Strains isolated from environmental sources of Vibrio parahemolyticus are usually hemolytic on high salt blood agar. Third, there is no difference in the pathogenicity among the 3 serotypes, that is Ogawa, Inaba and Hikojima. Fourth, group A cholera vibrios have a common O antigen. And fifth, it belongs to the Enterobacteriaceae group. Second is related to Naegleria fowleri. It causes an acute and fulminating primary meningoencephalitis. Second, it does not have the flagellate form of the trophozoite. Third, the parasite invades the cribriform plate and travels along the olfactory nerves to the brain. Fourth, humans acquire infection by swimming in freshwater lakes, ponds, or swimming pools. And fifth, humans acquire infection by inhalation of aerosol or dust containing trophozoites or cysts. The third is related to Listeria monocytogenes. So this can survive at 4 degrees centigrade. It shows a characteristic tumbling motility when grown at 35 degrees centigrade. Listeria are catalase positive. The selective medium is Palcum agar containing polymyxine, acriflavine, lithium chloride, ceftazidime, isculin, and maltose. In early onset neonatal disease, meningitis is the presenting symptom, while in late onset neonatal disease, sepsis is the common symptom. So now coming to round 2, that is the multiple choice questions. So answer the single best response. So mark out the single best response in your answer sheet. There are total of 10 MCQs with 1 mark for every question, that is 10 marks, and the time is 15 seconds per question. So moving on to the first MCQ. A 27-year-old man had a rhinoplasty. Nasal packing was done to control the bleeding. About 8 hours later, he developed headache, muscle ache, and abdominal cramps with diarrhea. He then developed an erythematous rash over his body, including the palms and soles. His BP was 80 by 50 millimeters of mercury. Nasal packing was still in place. His liver enzymes were raised and there was moderate renal failure. The patient's illness was likely to be caused by which of the following? Lipopolysaccharide, lecithinase, that is the alpha toxin, a toxin which is a super antigen, or a toxin which has A and B subunits. The Typhi dot test uses which of the following antigen? The outer membrane protein antigen, the O9 antigen, the flagellar antigen, or the lipopolysaccharide antigen. The Vietnam time bomb disease is caused by which of the following? Burkholderia pseudomallei, Burkholderia mallee, Burkholderia cepacia, or none of the above. In India, Japanese bee encephalitis was first isolated from the mosquitoes of which of the following? Culex tritirio-rhynchus, Culex annulirostris, Culex vishnoi, or none of the above. A tuberculin test was performed on a patient. 3 days later, there is induration and erythema, 32 millimeters in diameter at the site of the injection, a positive test result. What process produced the induration and erythema? Activation of complement, induction of a primary antibody response, invasion and lysis of epithelial cells by bacteria, cytokine production by CD4 T lymphocytes, and release of inflammatory cell envelope components from the bacteria. Which of the following bacteria is a small capnophilic gram-negative oxidase positive bacillus that can be isolated from human bite infections? Echinella corrodens, Moraxella species, Proteus vulgaris, or Burkholderia mallee? Laboratory diagnosis of relapsing fever is best made by direct detection of spirochetes in body fluids by hematological stains, culture of spirochetes in body fluids, serological detection of IgM antibodies in the serum, serological detection of IgG antibodies in the serum. Gastroscopy reveals that a patient with stomach pain has a large ulceration of his gastric mucosa. During the procedure, a biopsy of the stomach epithelium is obtained. Which observation would suggest Helicobacter pylori as a cause of illness? Biopsy shows infiltration of gastric epithelium by lymphocytes. pH of the stomach fluid is equal to 1 rather than decreased. Ingested isotope labeled nitrate is converted to nitrite in the stomach. Curved or spiral bacteria seen in the biopsy after silver staining, and bacteria are found in the stomach fluid but not in contact with the gastric epithelium. A 25-year-old girl admitted to the hospital with a provisional diagnosis of rabies. The most suitable clinical sample that can confirm ante-mortem diagnosis is serum for anti-rabies IgG antibody, corneal impression smears for immunofluorescence stain, CSF sample for viral culture, and GIMSA stain excuse me, on smear prepared from salivary secretions. The phenomenon of receptor editing occurs during the development of which of the following? B cells, T cells, natural killer cells or macrophages. So moving on to round 3, that is mix and match. Now there are total of 10 questions. Each question has 10 mix and match pairs. Total marks are 20, so that is 1 for each, and time is 2 minutes per question. So there are 2 columns in which there are 10 options each. You have to mix the pairs. So whatever. So you take one from column A and match it to small a, small b, small c from column 2. Okay, so I've given different numbers. So take the number from column A and match it to the small letter from column B. So we are giving you 30 seconds extra. Moving on to the second mix and match question. Again 10 options. Again match the numbers from A to the small letters from the column B. I now hand over the mic to Dr. Swati for the remaining 3 rounds.
Thank you, ma'am. So can we proceed to the next round? Okay. So it's a very interesting round. Visual. So the rules for this round are there will be total 5 visuals. Okay. And there will be 2 questions on each visual. Each visual is having 4 marks. So 2 questions, 2 marks for each sub-question. So maximum marks obtained in this round could be 4 into 5, that is 20. And time will be given for each visual, you will be given 60 seconds. Okay, so are the rules clear? We'll proceed now. So this is visual 1. Identify the condition and name the etiological agent causing this condition. Which cells and tissues are damaged in this condition? I think visuals are clear on the side screens also. We'll move on to next question. Identify and name the stage of the parasite demonstrated. So there is clue given to you. And where are they found? So you have to identify and name the stage of the parasite. So this is a parasite. You have to name the stage of the parasite and where are they found. Next question. Identify the condition and name the etiological agent and describe the typical morphology of the etiological agent. Moving on to next question. Identify the colony characteristic and there is a clue given which liquid medium is used to culture this organism. These are the colonies, so you have to identify the colony characteristic. Which liquid medium is used to cultivate this organism? Moving on to last question of this round, that is visual 5. This is a LPCB mount. You have to identify the fungus and mention the disease caused by this fungus. I think it's very easy. Please pick up all the clues given in the visual. All the clues are given in the visual. Okay, so we are finished with the fourth round, that is visual round. Moving on to next round, that is clinical round. So here we'll be giving you clinical condition and you have to write answers on the to the questions on that particular clinical condition. Okay, I request all the PGs to write the answer for this round on a plain paper given to you. So there is attached a supplement of plain paper to the answer sheet given to you. So you need to write the answer. You mention clinical 1, 2, 3, 4, 5 and you write answers to those below that. Okay, so please use that plain paper for answering this round. So total 5 questions in this round, 2 questions on each clinical condition and each questions have 4 marks. So 2 marks for each sub-question. Total 20 marks and again 60 seconds per question. So everybody ready? Can we move? So this is clinical 1. A mother of a 5-day-old neonate complained of a thick yellowish discharge in both eyes of her baby. The baby was febrile and able to feed properly. Gram stain of the exudate did not reveal any bacteria, but a Giemsa stain of the smear was positive for large cytoplasmic inclusions. So which is the probable organism causing this? And you have to name the large cytoplasmic inclusion body seen in the Giemsa stain. Next question. A 65-year-old patient came with complaints of dry cough, sore throat and fever. His swab was sent and it was positive for COVID-19 illness. So you have to name the gene targets used for screening and confirmation in PCR and name the various prognostic markers for this condition. I think answer is very easy, but try to write all the genes used for screening and all the genes used for confirmation. There were various kits which we are using and the genes used in it kit were different. Moving on to next question. A 40-year-old male presented with cough, fever, and lymphadenopathy. X-ray chest showed focal infiltrates and patchy opacities. Later, patient developed invasive lesion. The biopsy of the lymph node showed oval budding cells. Bone marrow of the patient was cultured on Sabrot's dextrose agar, showed mycelial growth with spherical spores with tubercles. Which is the likely fungus causing this condition, and how will you convert mycelial form to yeast form? No group discussions while writing the answers. Moving on to next question. Soon after the birth, an infant develops seizures and marked irritability, poor feeding and fever. The infant's birth record note a prolonged labor with premature rupture of membranes. What is the likely condition, and name the likely etiological agent? Name 2 tests used for presumptive identification of this organism. Moving on to the last question of this round, question 5. There was a sudden outbreak in a military camp where army men developed fever, cough with hemoptysis, dyspnea, and gastrointestinal symptoms. No such outbreak was reported from outside the army camp. Blood smears of one of the cadets showed septicine appearance of microorganism inside the red blood cells. You have to identify the pathogen and mention the mode of infection. I think it is the easiest of the 5. Okay, so here we come to the end of the 5th round, that is clinical round. Okay, so please listen carefully about the rules of the next round. The round is called as assertion and reasoning. Okay, so there will be assertion given to you, and there will be again reason. So there will be total 5 questions, each will have 4 marks, and total marks will be 20. 60 seconds per question will be given. This will be 4 options for each question. Okay? I think we have written that options in your answer sheet. You just come to the question number, round number 6, that is assertion and reasoning round in your answer sheet. So these are the options. So we have given the option numbers also over there. Just you have to click to the correct option. So all the question, these will be the options. That is A, both assertion and reason are true, and reason is the correct explanation of the assertion. The B is assertion and reason are true, but reason is not the correct explanation of assertion. Option C is assertion is true, but reason is false. And option D is both assertion and reasoning is false. Okay? So all of you are ready? We'll move to the next question. That is first question of this relationship analysis. So assertion is daptomycin started empirically for treatment of staphylococcal lung infections result in treatment failure. Reasoning is daptomycin is a peptide antibiotic used to treat wide range of staphylococci including MRSA. However, daptomycin is inactivated by the surfactant in the lung alveoli. Thus, daptomycin cannot be used for anti-MRSA coverage in ventilator-associated pneumonias and other lung conditions. You have to answer these, and these are the options. Next question. Antigenic drift accounts for major epidemics or pandemics of influenza. And reasoning is antigenic drift is an abrupt, drastic, discontinuous variation in antigenic structure result in novel strain unrelated antigenically to predecessor strain. You have to take correct option in your answer sheet. Next question. Assertion is Yersinia enterocolitica produces different reaction on triple sugar iron agar, that is TSI, and Kliegler iron agar medium, that is KIA. Reasoning is Yersinia enterocolitica ferments sucrose as well as lactose. Thus, on TSI reaction will be acid by acid, but on KIA reaction will be alkaline by acid. Next question. Assertion is when maternal varicella occurs near delivery, babies may develop congenital varicella depending upon onset of mother's rash. Reasoning: if mother develops rash 1 week or more before delivery, she should have developed antibodies which would have passed on to the fetus transplantationally. Such baby escapes clinical disease though infected. If mother develops chickenpox less than week of delivery, baby would have received from mother only the virus and not the antibody. So it develops the neonatal varicella. Just go through the question carefully and give answer. Moving on to the last question of the round and of the quiz. Assertion is presence of capsular polysaccharide is an important virulence mechanism for Streptococcus pneumoniae. Reasoning: capsular polysaccharide acts by inhibiting inflammatory response by activating CD4 cells and also by inhibiting membrane attack complex. After this, we'll be taking back your answer sheets. Please make sure you have written your name, that JR1, JR2, JR3, and your college name on the answer sheet. Okay, so that was the end of this quiz, PG quiz.
I want to make a special announcement here. We are going to have the most important session after PG quiz, and that most important session is we have a very special person who has come at our place. Dr. Anup Anvika is the director of NIB. So he specifically wants to talk to all the postgraduates. Therefore, all postgraduates have to sit where they are. They are not going out of this hall. No postgraduate is leaving the hall. Is going to stay because we have a very special guest who has come here. He is the director of National Institute of Biologicals, and he wants to talk specifically with you. So his whole lecture is oriented for you people. So I want everybody in.
All the postgraduate students, please hand over your answer sheets to our faculty members. They are present at the end of your rows.
Answers to this quiz will be demonstrated later on, since the lecture is right after this quiz. So we will show you all the answers later on.